Good afternoon, everyone, and welcome to our health talk. My name is Farah Schwartz, and my pronouns are she and her. On behalf of the Patient Education and Engagement Program here at the University Health Network, thank you for attending today's session on liver health. I'd like to take a minute to thank our planning team, the Patient Education and Engagement Program, the Learning and Experience Centers, Educational Technology and Media Services, and the Patient Partners Program. Now, a few words about our online format. This session is being recorded and will be available for viewing with closed captioning at the same YouTube link afterwards. Today, we'll have a presentation for approximately 30 minutes, and then we'll open it up to the audience to ask questions for the rest of this session. So if you have any questions about the live stream during the session, you can email us at pfep@uhn.ca. You can also request to arrange a phone call in your email, and a member of our team will get back to you shortly. On the topic of technology, we realize that anything can happen when it comes to internet connections. So, with that said, if my connection cuts out at any point, don't worry, one of my amazing colleagues will step in to facilitate the session. We also want to note that some of our speakers are presenting on site at the hospital, and because of that, you may hear announcements or alert codes in the background. If this happens, they'll pause until the announcements are complete. So we mentioned questions and opportunities to ask them. So to submit your questions for the presenters, we invite you to go to the link on your screen, and it's also in the description box below this video on YouTube. You can submit questions at any time during the presentation. And so thanks to all those who've already submitted questions, because it helps us see what people are interested in learning more about. And we'll try to address these during the presentation, but as if needed, we'll answer them during the question and answer period. Another note that's important is if you submit a question, you may notice it doesn't get posted right away. This is because we review the questions before they show up for the audience, which helps us make sure that questions won't be repeated and gives us more time to address new questions. So keep in mind a few things before you submit your questions. You can choose to include your name or you can stay anonymous. But please note that if you do include your name, people will be able to see it on the question. Please do not include any personal details about your health or your condition in your questions. Our health talks are for general information only, and the speakers are not able to diagnose or provide treatment recommendations. We'll also try our best to answer as many of the questions as we can during the question and answer period, but you can also vote for your favorite question by clicking the thumbs up button that you see beside the question. And that will help bring the more popular questions closer to the top so that they're more likely to be answered. We also really want to know what you think of this session. Your feedback is very important to us. So please go to the link on your screen and complete the survey at the end of the health talk, whether you're watching it live or recorded. The link is also available in the description box below. And we thank you in advance for for giving us your feedback, because it does help us a lot. So now moving on to our presentation. Today, we're going to hear from George, who is a UHN patient and is generally sharing his story with us today. We're going to hear from Kalina Yin, who's a nurse practitioner in the Toronto Centre for Liver Disease, and Tracy Warren, who's a community health worker in the Gastuso Centre for Social Medicine. And it's a great group of speakers. Before we get started, I would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land, and for thousands of years have cared for this land. Although we present this health talk in the digital world, we want to acknowledge and remind ourselves and encourage you to do the same wherever you are currently located, that we are on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still home to many Indigenous peoples from across Turtle Island. We are grateful to have the opportunity to work, learn, and play on this territory. Liver health and disease is prevalent in Indigenous communities within Canada. Traditional Indigenous wellness approaches have often been unwelcome and not acknowledged alongside biomedical medicine. So, as we do our health talk today, we consider traditional approaches and think about how we can look more at how to care for emotional, mental, spiritual, and physical health. And through true partnership with Indigenous communities, we can learn more about different ways of knowing about health and ultimately provide holistic and safe care for everyone. So now, for today's presentation, until about 1:40 p.m., the presenters will talk about what the liver does, most common causes of liver diseases, how to keep your liver healthy, the impact of social factors on liver disease, and resources at UHN and in the community for people to learn more. So now I'm going to hand it over to George to start us off.
Thank you for the introduction, Farah. My name is George. I'm a 61-year-old male living in Toronto, Ontario. I would like to take a minute to thank the liver clinic team at Toronto General Hospital for asking me to speak at this month's Liver Health Talk. I will start by talking about my diagnosis. Many years ago, during my annual physical, my doctor decided to do a random blood test to check my liver function. He called me a short time later to notify me that my liver counts were high and that he wanted to do a second blood test to see if anything had changed. The second blood test also came back with high liver counts. He recommended that I see a liver specialist to discuss the findings. I got an appointment at a clinic close to my home and saw the specialist. Based on the blood work provided, he told me that I had hepatitis B, which is currently a liver disease without a cure, and they would probably be on a cocktail of medications in order to suppress the virus. It was very shocking news to me and my family, considering I was feeling perfectly fine without any pain or symptoms. I decided that I wanted to get a second opinion, so I did some research and discovered that Toronto Western, which is currently moved to Toronto General, had a liver clinic that dealt with the latest medical advances in treating liver disease. I got a referral and got an appointment. They went over my records and explained that they would have to do a biopsy in order to determine my current liver health. Now I'm going to talk about my treatment. After getting the biopsy results, I was put on a study medication that showed good results initially, but my numbers elevated again. During the study, there was no cost for the medication. I was then put on a different non-study medication that kept my numbers stable in order to suppress the virus and prevent any further liver damage. The medication I was prescribed was very expensive. I'm employed and have medical benefits which covered 80% of the medication, and the extra 20% was a substantial amount. The team at the liver clinic recommended that I get in contact with the Trillium drug program to assist with the additional cost. I got set up and they covered the additional 20%. I continue to be on a prescribed medication that is keeping my virus suppressed. Talk to your healthcare team to find out whether there's anything available to help with the cost. Next, I'm going to talk about monitoring and support. I have been doing blood work and abdominal ultrasounds every 6 months to monitor my liver health and see my nurse practitioner once a year to go over the results. I also have a liver fibroscan done on occasion. I get monitored by my nurse practitioner. I get notified by my nurse practitioner of any new studies that may help cure or help my condition. Shortly after being diagnosed, I found a weekly Living with Liver Disease seminar, which was put on by the Canadian Liver Foundation in the evenings, which I attended and found very helpful. They covered different topics about the liver, nutrition, medications, guest speakers, and general sharing of personal stories with the attendees. Recently, UHN created a My UHN account where the patient is provided a login and a password and are able to look at their current and historical results. I found it very helpful to be able to see my results and ask questions for a better understanding. Now I'm going to talk about my insight. Liver disease can be a silent killer if it's not diagnosed and treated. If you have any family history or going on a vacation where hepatitis is most common, I strongly recommend that you see your family doctor and inquire about the Twinrex vaccine so you're protected. Talk to your family doctor during annual physicals. Based on your age, ask about vaccines or other proactive tests that can be done for early identifications of any issues. Make sure your doctor is aware of your family medical history so they can perform the required tests. It's okay to ask your doctor questions. To conclude, I want to talk about living with liver disease. In closing, I live a normal life, making sure to take my medication as prescribed, attend my appointments, avoid alcohol, staying active, and having a healthy diet. Some of the activities I enjoy are volleyball, ice hockey, golfing, hiking, camping, bike riding, and going to the gym. I recently found a section on the Canadian Liver Foundation's main webpage, and I wanted to share it with you. The liver is a resilient organ that's easy to ignore until something goes wrong. Because of its wide range of responsibility, a healthy liver can come under attack by virus, toxic substances, contaminants, and disease. However, even under siege, the liver is very slow to complain. People who have problems with their livers are frequently unaware because they may have few, if any, symptoms. Your liver is such a determined organ that will continue working when even 2/3 of it has been damaged. I want to thank everyone for their time.
George, thank you very much for sharing with us today. It's very helpful to hear about your experience. And now I would like to introduce everyone to Kalina Yim, a nurse practitioner in hepatology with the Toronto Centre for Liver Disease.
Hey, thank you very much, Farah, for the introduction. And also, I'd like to thank George for sharing your experience of your liver disease. So for the next 20 to 25 minutes or so, I will be talking to you about the functions of the liver and what happened if there's a liver damage. And I will touch on the top 3 most common liver diseases and give you some liver health tips. So first, I want to make sure everyone knows where the liver is. So I would like to ask everyone, take your right hand and then feel your ribs on the right side of your body. So that's where the rib cage is. And the liver actually is quite high up. It actually is behind the rib cage. It's well protected. It's underneath the diaphragm. And it is a pretty heavy organ. It can weigh anywhere up to 3 to 3.5 pounds. And the next one is, what are the functions of the liver? There are hundreds of functions that the liver can do. But what I really like you to remember is the main function of the liver is to synthesis. What I meant by that is it's like a manufacturing plant of the body. It makes a lot of important stuff for our body. So some of you may have just ate your lunch. So what happened to the food that go into your stomach? So the food you put in your mouth go through the esophagus, the swallowing tube, into your stomach, and then into your small intestines. And all the food will get digested into tiny, tiny particles, or you call it molecules, that is tiny enough that can be absorbed in the blood. So the blood leaving the stomach and the intestines will go to the liver first. It doesn't go to the heart right away. It does go to the liver. And that is where the liver do all the work. The liver will get all the nutrients from the food that you just ate, as well as all the toxins that your body does not need. So the liver will absorb all the nutrients and then make all the stuff. And then you would excrete the waste products from the body. So what does the liver make? It produces very important proteins, such as albumin, which is a blood protein, and also produce clotting factors. That is to the protein that helps us, our blood to clot. It also produces bile, which you need it to digest fat in your diet. It produces and regulate cholesterol level. It also stores a lot of things, including vitamins, minerals, and excess sugar. So it's called glycogen. So it stores glycogen in the liver. So when your body, the blood sugar comes low, then your liver will release glycogen so that you won't become low blood sugar. And the liver also makes immune factors to remove bacteria. And very important as well, it removes toxins. What are the toxins? Any medications that you take or alcohol, for example, that the liver will help to clear those from your body. And it also helps to get rid of bilirubin, which is a pigment that you will see that is made from the red blood cells. So you cannot have those excess in your body. So how common is liver disease? So according to the Canadian Liver Foundation, 1 out of 4 Canadians may be affected by liver disease. And it also affects people of all ages, like from newborn baby to adults, and affects all people with different ethnicities. Unfortunately, statistics show us that the incidence of liver cancer is on the rise. And according to the statistics, in 2020, out of 100,000 Canadians, 11 of them will die from chronic liver disease. So I show you 2 images here. The one is a healthy liver, which is, as you know, is full of nutrient-rich blood. So this is reddish, brownish color. And next to it is a severely scarred liver. So you can see it's very lumpy, bumpy. It's got rough edges. And this is what we call cirrhosis. Now, from the healthy liver does not go to cirrhosis like overnight. It takes a long time for the liver, for the scar tissue to build up. So there will be actually a continuum of scar tissue build up over the years. Overall, or in general speaking, you will not get cirrhosis for at least from ongoing damage for at least 20, 30 years. So generally, the liver can be damaged in 2 ways, either acutely or chronically. What I meant by acutely is the onset is very sudden. It happens in a previously healthy liver. For example, drug-induced liver injury is one example, or viral hepatitis. They both can give you acute liver damage. And if the cause of the liver damage is not managed, then the liver might go into liver failure. And yes, you will have symptoms like including jaundice. That means that yellow in your eyes, in your skin. You may have dark urine. And when it's getting worse, then you may be confused and lose consciousness. And if at the end that you may need a liver transplant or will come to death. Another way the liver can be damaged is chronically. So what we heard from George is a chronic liver damage from the virus. So what we mean by chronic is when you have ongoing liver damage for more than 6 months, then we would say that is a chronic problem. And if the ongoing damage is not being managed and you just allow it to have ongoing inflammation, and then once the inflammation is over, then there will be scar tissue formed. So that is what happened to the previous picture that I showed you, is a cirrhosis, a cirrhotic liver. It's become so much scar tissue, then eventually the liver will stop functioning. And that is what we call the liver failure. Now, once the cirrhosis is there, that also puts you at risk of liver cancer, unfortunately. So at the end, if the cause of the liver damage is not recognized and not managed correctly, then the outcome is not good. It will be either you need a liver transplant or you will die from liver disease. So how to know if the liver is damaged? I think we heard from George that in chronic liver disease is a lot of the time there are no symptoms. Why? Because the liver is a big organ. It's a very resilient organ. So it really need to be damaged at least above 60% before it'll give you some symptoms. Some people may experience symptoms, but the symptoms usually very vague, like non-specific. For example, feel tired, but there are many things that make us feel tired. It's not just liver disease. What about signs? Unfortunately, again, the liver will not give you any signs until it's got to the cirrhosis stage. And we also heard from George, yes, the blood test will be abnormal. That is the blood counts that will tell us when the blood counts are high, that really is a red flag. It tells us that, yes, there's something going on in the liver. So how the liver disease diagnosed? Well, I just said that, yes, abnormal liver test, it is important. That is why important to go to have your annual medical checkup. And we see that the liver numbers are high, that it gives us red flag there's something going on. It's not only the liver enzymes, we also, the blood tests really tell us a lot. It also tells us how well your liver functions. Okay, so the liver functions to us also, we can tell from the blood test, but they mainly consist of three things: albumin, bilirubin, and INR. So a little bit different from the liver enzymes. So liver tests, as you can see on the screen, ASTALT, it tells us ongoing inflammation. The liver synthetic function test tells us how well your liver functions. Well, what about ultrasound? Ultrasound tells us the size and shape of the liver, and also tell us whether there are lumps and bumps. FibroScan. So the picture you can see on the screen is the machine. It's called FibroScan. It's really an innovative way of telling us at what stage of your liver disease is. So it is done based on the principle of an ultrasound, but it is not exactly the same. It tells us the stiffness of the liver. So because when you have a lot of scar tissue in the liver will be very stiff, and you will have a very high number on the FibroScan, and that's the way that we can tell, yes, you have a lot of scar in the tissue. So normally, in general, if the FibroScan number is very low, then that means that you don't have a stiff liver. And finally, liver biopsy that George has also mentioned. So a lot of the time, if we can have the FibroScan diagnose the liver disease, then we would avoid liver biopsy. But sometimes liver biopsy is still necessary, is because we have to make more accurate diagnosis. So next, I'm going to talk about the causes of liver disease. Now, there are many things can cause liver problem. Because of the time, I just pick up the top three most common causes of liver disease, and they are fat, viruses, and alcohol. So the first one, if you have too much fat, then you may have something called non-alcoholic fatty liver disease, or NAFL. So basically, it's fatty liver without drinking a lot of alcohol, because when you drink a lot of alcohol, it can also cause fatty liver. Viruses. Now, viral hepatitis, the most common viruses that affect the liver are viral hepatitis A, B, and C. Now, be careful. A is usually self-limiting. Hepatitis A does not give you a chronic liver disease, but hepatitis B and C will stay in the body a lot of the time and give you a chronic problem. Alcohol you overuse, if you use alcohol too much, then will cause alcohol-associated liver disease. So now I'm just going to highlight each of these three liver diseases very briefly. NAFL. So who are at risk of getting fatty liver disease? Persons who are overweight and obese, yes, they are at a higher risk of getting NAFL, but it doesn't mean that everyone who are overweight or obese will get fatty liver though. We do have patients who are lean that will get fatty liver. So this is what we call lean NAFL. But the most important now, we know that looking at the person's body mass index, meaning looking at the height and weight, sometimes is not really representative of the person, whether they're at risk or not. So we really want to look at is the waist circumference. Look at whether the abdominal fat, when your abdominal fat is too much, then you're at a higher risk of getting NAFL. And also persons with diabetes, meaning high blood sugar, and those with high cholesterol, like lipids, including cholesterol and triglycerol, and they also at higher risk of getting NAFL. Then the next one is viral hepatitis. As I mentioned before, yes, there are A, B, and C, the most common ones. A does not give you a chronic liver problem, but it does give you acute problem. So how you get hepatitis A is when you inadvertently drink the water or eat food that have been contaminated with the virus. So I think the most important is when you have to keep in mind is when you travel to countries or regions where hepatitis A is common, then make sure that you to avoid having all the to make sure that you are taking precautions in preventing getting hepatitis A. So both hepatitis B and C share the similar transmission route. So basically, it's from blood to blood contact. So meaning that the blood contaminated with the virus have to get into my blood before I can get infected. So what are some of the routes that you can get the virus? Like if you use the contaminated injection drug equipments, or you practice unsafe sex, and those ones who were born in regions where hepatitis B is common, for example, in Southeast Asia, Eastern Europe, and Africa, and so forth. And also those who were born to mother who's infected with hepatitis B or C. And finally, I do want to talk about prevention. So how to prevent viral hepatitis is very, I think the best prevention is to get vaccination, okay? Because hepatitis A and B, you can prevent by vaccination. Unfortunately, there is no vaccine for hepatitis C. Practice good hand hygiene. What I meant by good hand hygiene is we want to make sure that you wash your hands with soap and water, and wash your hands thoroughly after using bathroom. That is the most easy way to get hepatitis A if you don't have, if you get contaminated through because you're not washing your hands properly. And practice safer sex to prevent hepatitis B and C. And do not share personal items such as toothbrushes, nail clippers, and razors, because we now know that the blood infected with hepatitis B and C, they can stay on dry surfaces for many days. And of course, do not share injection needles and equipment. And if you choose to have tattoos and piercing, like ears and body piercing, make sure that you choose the parlors carefully to make sure that the equipments that were used are all clean and disposable. So next, about alcohol-associated liver disease. So I just want to make sure that we all understand what is one standard drink. So 1 can of beer, 5% beer, and a 5 ounce of wine and 1.5 ounce of distilled spirits, they all considered as one standard drink, meaning that they contain the same amount of alcohol. So a lot of patients say, well, how much alcohol can I drink? Some of you may have heard that the Canadian Centre for Substance Use and Addiction, CCSA, they came up with a new drinking guidelines early this year. So basically what they say is there's no amount of alcohol is considered safe. So because remember, the alcohol does contain toxins that need to be metabolized by the liver. So if you have the recommendation is you have 2 drinks or less per week. If you drink 2 drinks, like 2 alcoholic drinks per week, that is considered low risk. If you drink 3 to 6, like alcohol drinks per week, that's moderate risk. Anything if you drink more than 7 per week, that is high risk. And again, there is no a specific number to say, well, how safe it is. It basically is really depend on us or you to decide what kind of risk that you're willing to take. Well, I'm hoping that like everyone, we just want to have a low risk, right, to your liver disease. So what else at risk drinking? So if you binge drink, someone binge drink, like what does it mean is if you drink more than 5 drinks in a setting, also put you at risk of liver disease. And if you already have a type of liver disease, for example, hepatitis B or C, then you continue to drink, that also put you at a high risk of getting alcohol liver disease. And is definitely you want to avoid taking alcohol with medications. Now, Tylenol, we heard so much about Tylenol. Yes, Tylenol is bad for the liver if you take it more than 4,000 milligrams or 4 grams per day together with alcohol. And that is definitely really bad for the liver, and that can give you acute liver problem. So the next thing is I just really want to touch on about liver cancer. Now, George did mention about having ultrasound every 6 months because who are at risk of getting liver cancer. Unfortunately, persons who have chronic hepatitis B, it's just because hepatitis B is such a nasty virus. When you have the virus, you are inherently at a high risk of getting liver disease, and also persons who have cirrhosis. So, but liver cancer can be cured if the cancer is found small. So this is why we recommend all the patients with hepatitis B or who have cirrhosis to undergo ultrasound surveillance every 6 to 12 months to find liver cancer if there is one when it is small, and then we can manage the cancer more easily. So the next is we talk about how to keep the liver healthy. And if you are taking a liver medication, as George has pointed out, make sure you take your medication every day as prescribed. Do not skip a dose or stop without discussing with your doctor. I have personally seen many cases that people run into problem because they miss the medication. And it is especially very important if you're taking antiviral or immunosuppressive therapy. The next is if you have diabetes or high cholesterol level, if you can control the blood sugar level and control the cholesterol level, will help prevent having fatty liver. And lose weight or lose abdominal fat will help to keep your liver healthy. And I said before, get vaccination for hepatitis A and B, and try to avoid things that may injure the liver, including alcohol, being overweight, avoid viruses, and a lot of people don't understand, realize that there are many liver herbs that on the advertisement and commercial, they actually are toxic to the liver. So the next slide I'm going to show you, these are the list these are the herbal medications that have been reported to be harmful to the liver. Of course, this may not be a complete list, but these are the compounds or medications that have been reported. So there's evidence showing that they are bad for the liver. So these are the ones that should be avoided. And second last slide is healthy lifestyle is key to healthy liver. I think George has also pointed to that. Make sure that you eat a well-balanced diet and go to the Canada's Food Guide for more references to give you the guide how to eat healthy. And don't forget about exercise. The current recommendation is to exercise 4 days a week and keep a healthy weight for your body. If you're overweight, but you do or obese, try to aim for gradual and sustained weight loss. It's not a rapid weight loss because that will not help. Quit smoking if you're smoking, because there are studies that showing association between smoking and liver cancer. And also avoid alcohol as much as you can and drink coffee. So this is my last slide. So this is what I tell my patients, like, don't spend too much money, like all the money on buying the supplements, like from the market or from the commercial. Drink coffee, because coffee has been proven, like over the past 10 years, I would say, that it actually is beneficial to not only the liver, but also to other diseases, for example, diabetes. So in general, drinking 2 to 4 cups a day is safe. Of course, like if you have other contraindications, for example, like you are pregnant you have high blood pressure, you cannot tolerate coffee, then of course you cannot drink coffee. But overall, in general, coffee will help to improve your liver enzymes. It will lower the risk of liver disease and lower the risk of liver cancer even. And for people with NAFL, it also helps to reduce the liver scarring in the liver. So there are benefits, and these have been proven in studies. So just I would like you to keep that in mind. So I think that's all my presentation. So yes, so thank you very much. And really, I look forward to if you have any questions.
Thank you, Kalina, for this helpful and thorough information. And I think it's a great note. People will be relieved to know that coffee is not only not bad for them, but is actually good for them. So I'm now excited to introduce our last speaker of the day, Tracy Warren, community health worker with the Gattuso Center for Social Medicine.
Hello, everyone. I'm also glad to hear that my morning coffee is good for me. Thank you both to George and Kalina. I always learn something new. My name is Tracy Warren, and I'm a community health worker with the Gattuso Center for Social Medicine at your University Health Network. Social medicine is working in partnership with the Toronto Centre for Liver Disease to help address health equity issues for liver clinic patients. So according to the Ontario Public Health, health equity is when individuals have fair opportunity to reach their fullest health potential. Many causes of health inequities relate to social and environmental factors. These include income, social status, race, gender, education, and physical environment. Our goals for achieving health equity include bridging gaps for people who have less access to healthcare, and to provide every patient with quality healthcare despite barriers. To do this, we look at the social determinants of health. So these are the non-medical factors that have an impact on health. This can be helping people find a safe, affordable place to live, an adequate income, social belonging, and opportunities for education. Often change is required at a structural level to build health equity, and I'll take you through some quick examples of structural health inequities in Canada. So one slide back, actually. So this is the one that is the article from Canadian Medical Association Journal. It's a study that looks at the widening social and economic inequities in Canada and finds that people marginalized socially and financially are more likely to die premature and avoidable deaths. Here we have a local story about how the areas of Toronto with the highest socioeconomic inequities had less access to vaccines during the first years of the COVID-19 pandemic. Organizations, including the Center for Social Medicine, helped respond by running vaccine clinics close to home, in shelters, and with community members as part of the outreach and education. And here we have a graph that shows that people with low income are less likely to afford their prescription medication. We know that families in Canada are making difficult decisions between paying for rent, food, or medications. The pandemic has been really an added financial stressors on Canadians. Social assistance levels remain the same despite increasing costs of food, local travel, and housing. At UHN, the Center for Social Medicine and the Toronto Centre for Liver Disease partnered for a pilot project to add a community health worker to the liver clinic, and that ended up being me. As a community health worker, I work with patients who are struggling to make ends meet, who are struggling to balance the priorities they're facing, and to get additional supports they may need. I often help people apply for financial benefits they're entitled to so they can access medications, food as recommended by their care providers. I help people get home care supports when they're isolated and at risk of falls. For people who are unsure of how the healthcare system works, I can offer to attend appointments with them. This one-to-one work that I do isn't an answer to structural health inequities. It's like the second picture that we saw earlier, where people can't reach the food. People of different heights can't reach the food until they have the appropriate number of blocks underneath them. So that's what I do. It's a kind of harm reduction, these blocks. A better picture of health equity could be when people can access that fruit on the tree without blocks. No matter what their height, they have access to what they need. I also talk about health equity with care providers as often as I can. It's a reminder that health equity takes teamwork. Ask providers to commit to building trust as healthcare providers and to provide opportunities for peer connections, to continue to be honest and have boundaries, to empathize with patients, to respect self-determination, to use language interpreters, and to always carry hope for patients to reach the goals. Thank you.
Tracy, thank you for sharing your work and for helping to also illustrate that there are factors that are beyond people's control and that they need extra support with. It's more than just the physical needs, and this is important work to highlight today. So thank you.
Thanks.
So we're going to end our presentation today before we move to questions with just a few resources for people who would like to find more information. Here is a list of resources where you can learn more about liver health and resources available. And all of these will also be available under this video in the coming days so that you can access those resources and find them at any time. And of course, we always like to remind people that our patient and family libraries are available at all UHN sites for finding information, where we have trained health information specialists that can help you find the information that you need and that's up to date. So you can call them at any time or email them for support. And so thank you everybody for listening. And now it's time to go over to our questions. I'm just going to go back 1 second and pull up our questions. So our first question is, are people who donate a part of their livers through living donation at greater risk of liver disease later in life?
Okay, so I can answer this question. So that the quick answer to that question is no. Even though I'm not involved in a transplant program myself, but I do have patients and families that have undergone a living donation. So the donors have, in fact, to undergo a vigorous pre-transplant assessment to ensure that they are totally eligible or healthy enough to donate part of their liver. In fact, like the donor, after they donated their liver will grow back to the original size almost like within 12 weeks. That's what I was told. So very quickly, because your liver can regenerate. It's regenerate at a remarkable rate. Are they at a greater risk of liver disease later in life? No, it will not, because the liver, after donation, after it grows back to its normal size, it will continue to function normally. And of course, I cannot speak about whether the donor have other risk for liver disease later in life. But that risk of liver disease is not related to the donation. I hope that answered that question.
Thank you. I think you did. Okay, next question. And you addressed this, so just if there's anything to add, a warning I always see with Tylenol use is liver toxicity or failure. How much or which frequency of use is damaging to the liver?
Right. Okay. So it is such a common question because we know that if you look at any over-the-counter drugs or any prescription drug, they always say there is something would make damage the liver toxicity or cause liver failure. And Tylenol is one of them. Remember when I talk about the function of the liver is any drug, it always needs to be broken down by the liver. So meaning that the more medication that you take, the more work that you're asking your liver to do. So Tylenol, if you're taking in the recommended dose, it should not give you any problem. So the recommended maximum dose per day is 4,000 milligram, which is like if you take 500, the extra strength, which is 500 milligram per day. So you cannot take more than 6 tablets a day. So, but if you do need it and on a daily basis, like, for a long time, that is not good because you like any drug taken for a long time is not also, of course, it's not good unless that is prescribed and then you need to have like certain condition. But the main thing is do not take Tylenol together with alcohol. Tylenol itself is rarely or uncommonly can cause liver damage or liver failure. But if you take Tylenol, the excessive amount together with alcohol, yes, it can cause damage and it can cause acute failure. So be careful when you use Tylenol. In fact, our patients with cirrhosis, remember, is meaning that have a lot of scar tissue in the liver. We actually recommend them to take Tylenol and not to use other type of pain reliever, such as what we call the NSAID, non-steroidal inflammatory medications, because NSAID, for example, is Motrin, Advil, those are NSAIDs. Those actually is not only bad for the people with cirrhosis, they can also cause damage, like cause problem to the kidney. So those patients, in fact, we suggest them to take Tylenol in a safe amount instead of using NSAID.
Thank you, Colina. I think that's probably also very reassuring. I can remember many times where I was struggling with the Tylenol dosage for my kids as they were growing.
Yes.
So hearing, of course, we need to take it seriously, but
yes,
that it's less maybe than Tylenol gets a rap for is great to know. Okay, next question. What is the success rate for liver transplant recipients, especially from liver failure caused by an autoimmune condition? And for this one, I'll jump in and say that unfortunately, this is out of our topic today because it's not within the expertise of this program, although there is a wonderful transplant program at UHN, and we will definitely feature them in a future health talk. So sorry not to be able to answer this one today. Okay, next question. Does adding animal liver to your diet help with liver health?
Okay, so animal liver is, I guess it would be pork liver, beef liver. No, there is no evidence saying that it will like help, like sort of add additional benefit to liver health. It's an organ meat, don't forget, and it does have a lot of iron in it. Some people hated it, some people love it. And don't forget that it's a lot of iron. So I would say if you like the taste, go ahead for it. But always remember your diet should be a well-balanced diet. Okay. So you can eat liver like once a week or whatever, but don't eat it every day. I think that's what I would say is a well-balanced diet. But there's no evidence saying that eating liver will help with liver health.
Thank you. Very understandable how someone might think that, though. Okay, we have another question about liver health, and maybe
Yes.
this is a myth that many have heard. My mother always tells me that sleeping very late is not good for my liver. Is there any truth to this?
Well, as far as I know, there's no evidence showing that sleeping late will hurt your liver. Don't forget that sleeping, it is important. Like sleeping helps. We know that like by having adequate sleep will help your well-being in general, right? It's not only the liver. So you do, if you are able to sleep, like it's the quality of sleep that we need to think about. So make sure that your sleep is high quality. That means that you don't have interrupted sleep during, like, and then when you sleep, that you're able to sleep like maybe 6 to 8 hours. It doesn't matter the time that you go to bed. So I don't think that it will harm your liver if you go to bed late, as long as you get your enough sleep.
Thank you. And for anyone who's interested in learning more about sleep, we do have a health talk from a few months ago. So please check that out as a recorded session if you'd like to learn more about sleep. Okay, our next question is, once vaccinated with Twinrix, how long does the protection from the Twinrix vaccine last?
Okay, that's a very good question. So Twinrix contains vaccinations to protect you from both hepatitis A and B. And you do need 3 doses, like at 0 month, 1 month, and 6 months, in order to get the complete protection. So once you completed the 3 doses of the Twinrix, it should last you for a long time. Like, I don't think anybody can say it will last you forever, but it will last at least 10, 15 years. So even though that all vaccines actually over time, the antibody or the protection level will decrease over time. It's the same as Twinrix. But your body will have something what we call the amnestic response, is that memory cells, that if you have the vaccine before, and then even though the antibody, the protection level goes down a little bit, if you come into contact with the virus again, your body's immune system will have the memory cell will kick in and give you the protection. So at this point in time, there's no recommendation to get any booster or to get extra doses after you complete the 3 doses of the original dose.
Thank you, Colina. And if people are interested in learning more about the Twinrix vaccine, should they speak with their primary care provider?
Yeah, that's definitely, yeah. So usually if you can get Twinrix, because I think if someone in the household or your family have hepatitis B, you can get the vaccine free of charge. And if you need to have the vaccine, but you have drug plan coverage, then it will be covered as well. But make sure that you talk to your family doctor and to get the advice as well.
Thank you. And thank you also for mentioning that there may be some cost and coverage considerations. That's really important for people to consider too. Okay, next question. Colina, you recommend drinking 2 to 4 cups of coffee a day. Does it have to have caffeine or can it be decaf?
Yeah. So it is. So the study have shown that it is not the caffeine that is in the coffee that is the benefit to the liver. Is all the little things that contain in the coffee as well. So what they're saying that yes, is the caffeine, and either coffee with caffeine or decaf will have benefits to the liver.
That's good to know.
And not green tea. That's because there's some studies they actually compare coffee with green tea, and they find that the coffee is much more beneficial than green tea.
Wow, that's really great to know. Thank you. Okay, this is our last question, unless any others come in. Is AIH a common condition?
Okay, so AIH refers to autoimmune hepatitis. Yes, it is one cause of liver disease. So in terms of prevalence or how common it is not very common. In fact, like this morning, it's very interesting. I was just listening to a talk looking at the epidemiological data in Ontario. So I cannot remember to quote the incidence or the prevalence, but the impression is, the message that I got from this morning's talk is that the AIH is on the rise. So it is not common, but it is prevalent in certain populations. So if you suspect, but again, AIH does not give you symptoms. It's just like many other types of liver disease. but it will show in your blood test. If certain types of blood tests will be abnormal, then your doctors will have to go investigate further.
Okay, thank you. Okay, so that brings us to the end of our questions. And right on time because we're nearing the end of our time together today. So thank you very much to all the presenters. If you still have questions for the presenters today, please email us at pfep@uhn.ca and we will do our best to respond to your question within 1 week. As we mentioned, your feedback is very important to us. So please go to the link on your screen and complete the survey. And you can also scan the QR code using your smartphone's camera or QR code reader app, and it will take you to the survey. So please do fill this out whenever you happen to watch this talk and tell us what you think. To find out about our next talk, subscribe to our online patient e-newsletter and get up-to-date information about events and new resources at UHN. To fill out the form to subscribe, also please go to the link on your screen, and it will also be available on the confirmation page of the feedback survey so that you can always get more information. So thank you so much. We appreciate your time today. Thank you to all the speakers. We will be taking a break from the health talks for the next few months, and we'll start again in September. So we're looking forward to seeing you then. And in the meantime, please remember that you can always see all of our talks in their recorded versions on our YouTube channel. And we hope you have happy watching. Thank you.